Hello and welcome to a special interview for The Wire supported by Glenlivet Books. How effectively is vaccination being conducted in rural and tribal areas and in slum settlements and cities? After all, those are the areas where the majority of the Indian population lives. My guest today has serious concerns which need to be not just understood, but more importantly, addressed. Joining me now to share those concerns is the CEO of Azim Premji Foundation, Anurag Behar. Mr. Behar, you've been working with over 500 primary healthcare centers across 12 states in mainly rural and tribal areas, as well as slum settlements and cities. And I want to talk about what you found, which you've also written about in Mint. Let's start with the good news. You write, vaccine hesitancy is less common and not as intransigent as often imagined. A common error is conflating unwillingness to get vaccinated for good reasons with hesitancy driven by unfounded fears and beliefs. Your point really hinges on that critical distinction. Could you explain it further?
Karan, thank you. It's a pleasure to be here with you. And yes, indeed, that distinction is really the crux. And the distinction is fairly simple. If you don't want to get vaccinated because of some false beliefs, and the false beliefs that we have encountered very often are that if you take the vaccine, you will die. If you take the vaccine, it will cause infertility. If you take the vaccine, then you have alcohol, you will die. So you have these false beliefs because of which you do not want to take the vaccine. Another kind of a false belief is, if I work very hard in the fields, and I sweat every day, I don't need the vaccine. So if you don't want to take the vaccine because of these false beliefs, that is usually called vaccine hesitancy. Now, too often we conflate that with when people do not want to get vaccinated for good reasons, for very good reasons. And what are those good reasons? Let's take an example. Well, you're wanting me to come to a vaccination center which is 5 kilometers away. If I come there, I will lose the entire day's wages. Or if I get vaccinated, I have heard that I'll get some fever for 2 days, 3 days. That means I can't go out to work. What will happen to my wages? Or simply this, that, I was there for a vaccination 2 days ago and I had to wait for 5 hours. The vaccine, my turn didn't come up. So now I've gone back. Now I don't want to go, right? So these are two very, very clear distinctions. Vaccine hesitancy, which is founded on false beliefs, and what I have phrased as unwillingness to get vaccinated for very good reasons. And if you conflate the two, it is indeed a problem because they need to be addressed in different ways.
Absolutely. And the good reasons can be tackled by sensible responses from the people who are connected with doing vaccination. The other good news is what you claim when you say infrastructure to deliver vaccines is mostly adequate. I take it you're talking here about cold chains and the transportation system.
Yeah, that's correct. That's mostly it, which is the cold chain. And the cold chain is right from where the vaccines come into, let's say, a state where they have the storage centers. Then they're distributed out onto the district places, then further on into the primary healthcare centers or wherever. So one part is the cold chain. The other part is the transportation system supporting the cold chain. And then also the transportation system that takes the vaccines out from the last point of storage to where the vaccination is happening, right? So the cold chain, I think, is well in place. There are other things like, what are called hub cutters, which sort of cut the end of the vaccine vial. So the infrastructure is reasonably well in place, and that's pretty much true across the country. In a country of our size, you'll always have a few problems here and there, but that's not a matter of concern as we have encountered.
Let's now at this point switch from what I've been calling good news to the problems that you've identified. And I'll add for the audience that you are perhaps the first person to have identified these specific problems. First of all, you say the number of vaccinators is inadequate in rural areas, difficult terrains, and slum settlements. 20% places are facing shortages. Now, delivering vaccines in rural or difficult terrains or in slums is something India has been doing for several decades. How does the government explain the 20% shortage of vaccinators?
So, Karan, Before I go on to that question, let me point out one more bit of good news. We can come back to that later, which is that vaccine supplies increased tremendously. If the vaccine supply had not increased, we won't be where we are. Now, the point that you are referring to as to why is it that we have done such large vaccination drives, and still, as far as we've seen, about 20% places are short of vaccinators. Why is it so? The answer actually is just because of the kind of vaccine this is versus the other kind of vaccinations that we've done. So if you think of the polio vaccine, it's an oral vaccine. If you think of the BCG vaccine, again, it's an injectable, but with children. So one, what is the kind of vaccine this is? And two, even more importantly, this is a vaccine through which you have to cover the entire population quickly. The other vaccination drives and the very successful vaccination drives that we've had, we've never had a situation where we have said, look, we are running against the clock. We have to vaccinate all the population as fast as possible. Now that requires a different kind of capacity. When I say capacity, the staffing, the number of vaccinators, right? So the moment you drill it down to that level and you say, look, what kind of vaccine is this, which means a intramuscular injection, and that you have to cover the entire population, we are not adequately staffed to cover the entire population in very many areas. In some places we are.
Tell me something, is this a problem that could have been foreseen and therefore tackled in advance? And therefore, is the government to blame for not having foreseen it? Or is this a problem that only would have been realized once you began vaccination?
Could the problem have been anticipated better, more? I think so, yes. Could it have been solved very quickly? I don't think so. This is really hard. We are talking about a vast country. We are talking about the remotest areas, the most difficult terrains. To get vaccinators in there is really hard. So should we have anticipated better, planned better? Yes, definitely. But would it still have led to this kind of a situation? Maybe not this kind of a situation, but still we would have had tremendous problems. Now, this is a hard thing to do. We should not underestimate that.
A bigger set of problems emerge out of data. There are two in particular that I want to discuss with you. First, you say over 90% places have multiple and substantial problems to do with data. First, with patchy net connectivity, entering each individual's data for vaccination into the computer system is a herculean task. As a result, you say data handling has become the primary job rather than vaccination. That's exactly the wrong way around, isn't it?
It certainly is. It certainly is. And, it shouldn't take us by surprise at all. I am right now in Jaipur, and wherever I am, the connectivity is not so good. Now, you go out into any parts of the country, the connectivity is what it is. And therefore, taking the data, collecting the data, the identification data, the Aadhaar card number, or other identification number, and then putting it into the system, that system which is presumably online, one can imagine how difficult it is. In very many places, there is no connectivity at all. In very many places, the connectivity is so poor that you just keep getting cut off. So you have a situation where you have people coming in to get vaccinated, and let's say you have a 2-member or 3-member team, and they're mostly focused on somehow getting the data and putting it online if there's connectivity. Otherwise, they will just put it down on a register. So think of this, that there's a primary healthcare center which is running a vaccination camp, which is 10 kilometers inside some jungle, and they have no connectivity. So they will get all the names, put it down on a register. They'll do the camp till 4 p.m. in the evening, drive back to the PHC or ride back to the PHC, then sit down and put the data back in. And that again assumes that the PHC, which is the primary healthcare center, that has good connectivity. So this is very problematic, right? Very, very problematic. And very often what's happening is that the very individuals who are vaccinators, very often, they are also the people who are handling this data. So therefore, instead of vaccinating, they are handling the data.
This is surely a problem the government should have anticipated And therefore, this is surely a problem the government should have catered for in advance, because the government knows better than anyone else how good is the connectivity and what problems will arise if the connectivity is poor. So surely this is an area where if you are facing problems, it shows the government has been lax in not anticipating and catering for them.
I don't know, Karan. I mean, I think there are some underlying assumptions here. Right? There are some deep underlying assumptions because of which the system is designed the way it is. And one of the underlying assumptions is that we should make sure that we are tracking everybody who's getting vaccinated. Right? The underlying assumption that people are out there who will come and get vaccinated, and therefore we need to track them. Right? That seems to be the basic underlying assumption, versus a situation where you recognize...
No, hang on a second. I'm stopping you. I'm not talking about the assumption that people will come forward of their own volition. I'm talking of the fact that whether they come forward of their own volition or whether you have to go out and persuade them, you still have to enter their data into the system. And that is the problem a government could have and should have anticipated. They know that connectivity is bad. They know that entering it into computers will be difficult. And if they didn't cater for that, then surely the government is to blame for not having foreseen a problem which they should have. Let's stick to that first.
Yeah, that's true. Absolutely true. And, the reason I'm hesitating in saying that is I don't want to blame the government. This is a very complicated task, very, very complicated task. So it's, in all such things, we find it, I think, very easy to blame the government. I think we've never done something like this before.
No, but maybe. I'm interrupting you again. Why not blame the government? They are the ones handling it. They had a whole year to prepare for it. They are aware of the problem, and therefore they should have devised other ways of entering data, perhaps by opening registers, perhaps by not insisting that they immediately get fed into the system, but doing it later, perhaps by ensuring there are more people so that vaccinators continue to vaccinate whilst others do the entering into registers. Those are simple things government should anticipate. Why not blame them?
So that's correct, Karan. This should have been anticipated. That connectivity is what it is across the country. And if the data is so central to this particular matter, this should have been anticipated, for sure. And I think what's happening is that, given that that's been the underlying assumption of the system design, now various state governments are doing various kinds of things to address the problem. And some of it is reasonably successful, some of it is still struggling.
There's a second problem connected with data, which in a sense is much more serious than the one we've discussed. You say the data in the system does not have the addresses of individuals vaccinated. And that's the key. But at this moment, people listening to the interview won't understand why are addresses of people being vaccinated so critical. So can you explain this?
Yes, Karan. So I think this one is a bit, let's call it technical. So we could just go step by step on this. So the data in the system, in the way the data structure is designed, it does not capture the address of the individual. So it has the age, it of course has the name, it will have some identification ID, but it does not have the address, right? Now, if it does not have the address, you don't know where the person lives. Now, let me paint a picture for you. Let's think of a primary healthcare center, which is handling, let's say 10 or 12 villages, a small town, an overall population of 50,000 people. Now, when you do the vaccination drives, what's happening is perhaps 20,000 people have been vaccinated of those 50,000, spread across those 12 villages in a small town. But those 20,000 people, where do they live? The people at the primary healthcare center who are responsible for the vaccination, they don't know that. So now imagine, you're at the PHC, and then you have these 20,000 people vaccinated, of the 50,000 that you're supposed to vaccinate, and you don't know where they live, this village, that village, if that small town, which mohalla, you don't know that. So what do you do now? So when the second dose time comes for these people, what are you going to do? How are you going to trace them? Not just that. Now that you have 20,000 people vaccinated, and you have the other 30,000 to be vaccinated, you don't know where these 20,000 are, where those 30,000 are. And therefore, how do you run a campaign to vaccinate. So it seems so elementary that unless you have the address of people as to where do they live, you would not know where to go to vaccinate them. And therefore, if you permit me, I can go on. Therefore, what is the issue? The issue is the underlying assumption in this design that you don't have to go out and reach to people to vaccinate them. And that's why you don't need the address.
Absolutely.
So they will come to you.
Let me stop you there because I want very much to discuss that assumption in a moment's time. But first, let's come to the consequences of not having addresses. The first consequence you point out is that primary healthcare center staff often make a few hundred calls a day to contact people. But even those calls are by no means sufficient because phone numbers are inaccurate, people don't respond, connections are poor. So once again, an awful lot of effort is being put up to make up for the fact you don't have addresses. And that effort, because people don't respond or because the phone numbers are inaccurate or because connectivity is poor, that effort is often wasted. So once again, just like people spend a lot of time writing in registers who's been vaccinated, others spend a lot of time trying to trace people to get them to come, often without success. So again, people who should be vaccinating are having to do other things instead.
Yeah, that's correct, Karan. That is absolutely correct. And what's happened over the past few months is that various state governments, or not even states, but within states, various districts have sort of developed workarounds, right? And let me give you an example of a workaround. One workaround is that, and again, this would seem slightly technical, but in the way the systems are designed, potentially, you could assign what is called a vaccination center number to each village, right? And if you do that, you can potentially at least identify which village somebody lives in, right? But that's a workaround. It's not as though from a system design perspective, the address is in there. So yes, indeed, this whole business of not knowing where people are, what it leads to is essentially a lot more work and a lot less planning.
Now, once again, is this something the government should have anticipated? This is where the assumption comes into play. The government, as you say, operated on the assumption that people will, of their own accord, come and get vaccinated and no effort will be required to reach out to people systematically. But was that assumption a correct assumption or even a logical assumption for the government to make? Because if the answer is no, then this problem should have been anticipated and catered for.
One should not have assumed that people will come to get vaccinated. One should not have assumed that. It is true that a large number of people would come and get vaccinated. We have seen that happen, right? But in a country of our size, with the kind of difficulties that are there to go to some vaccination center, will the vast majority come and get vaccinated? No. We've had vaccination campaigns earlier where you basically take the vaccine out to the people, right? So the underlying assumption that people will come and get vaccinated at centers is a flawed assumption, right? The assumption that you have to go out and get people vaccinated. When I say you have to go out, it is not necessary that you have to go out house to house to get people vaccinated. But you can't be sitting inside the primary healthcare center. You have to go out to the village, to the mohalla, and get people vaccinated. Karan, let me continue. I must mention that if I go back 5 months ago, across most states that we were dealing with, there was very little vaccination happening outside these primary healthcare centers or hospitals or sub-centers, as they're called. Meaning, there were very little camps happening inside the mohalla or the villages. Now, that has changed dramatically over the past 3.5 months. Very much across the entire country, as we observe, the vaccines are being taken out into the villages and the mohallas, and attempts are being made to vaccinate people near where they live. But the kind of data structure that we have, the matter that you referred to, which is we don't necessarily know the addresses, what that is leading to is it's leading to inadequate planning. You don't really know where you got to go and do these camps.
Absolutely. And what you now need is a set of teams on the ground that can go and mobilize local populations. You mentioned this in your Mint article. But those teams don't exist. And so just when you need them, the teams that are required to mobilize don't exist.
Well, again, that's a sort of a mixed reality. The teams exist or can be made to exist. So let me not take the name of a state, but I think a few states are doing a reasonably good job of putting together teams on the ground, which is government school teachers, Rozgar Sahayak, Panchayat people who are doing the mobilization, right? There are states where there's no focus on this particular matter. But the essence of what you're pointing to, is that there is a system that's delivering the vaccine. And then there has to be a set of teams or a system which mobilizes the people, coordinates the people, and gets them to the place where the vaccination is happening. Right? And there is clearly an inadequate focus on the mobilization side. And again, I guess the assumption that somehow people will just come and get vaccinated, that seems to be sort of marring this whole thing.
Now, this is where, in fact, we are beginning to talk about lack of careful thinking on the part of the government. The first is what you call a flawed assumption that people will come on their own, they will be self-motivated, you don't need to mobilize them, you don't need to reach out to them. That was not just a flawed assumption, but even in developed countries, Britain and America, they have systems to actually reach out and make sure that people come. They don't rely on people motivating themselves. And yet the Indian government seems to have, in India, relied upon self-motivation rather than set up a system to reach out to people. And that's the first problem. The second, having discovered this problem, the government seems to be slow in setting up the teams, which you say can be easily put together, and several states are doing it on their own. But this needed to have also been done in a more systemized way by the center, and it hasn't.
So, Karan, let me take your second question and bridge it back to the first. See, I don't think that this is a matter which the government of India could have handled or can handle. The execution on the ground is planned for, thought through, executed by the state governments, right? And therefore, some state governments have done a much better job. Most state governments, I think, have done an inadequate job. This entire mechanism, whether it is the mobilization on the ground or whether it's the delivery of the vaccine, is the business of the state governments. And as you mentioned, we are working with hundreds of PHCs across multiple states, and we can see the differences on the ground very, very clearly.
Okay.
That how well organized some states are and how poorly organized some other states are.
But the important point is that the two areas where the system was badly designed was firstly not to ensure that people's addresses were put in so you can reach out to them. Now, the only way you can reach out is to do it by phone, and in rural areas, phones don't work, the numbers are inaccurate, the connectivity is poor, it also wastes an awful lot of time. And the second flawed assumption, as you point out, was the belief that people will come on their own. These are two things that should have been and could have been corrected. Now we have to find ways of getting around them. But the net result, and that's the very important thing, the net result you point out is that second dose coverage is running about 25% short of what it should be. 25% is a fairly large percentage, isn't it?
So, Karan, the first thing, when you said two flawed assumptions, actually the same assumption. They're not two separate flawed assumptions. It's the same assumption that somehow people will come and get vaccinated.
Let's take it as two parts of the same assumption. I don't think we need to differ on this. For the audience, because we discussed it as two separate issues, it's easier for them to understand as two separate issues. The failure to take addresses, and therefore you can't contact people when you need to, and therefore you can't ensure they come for their second jab. And the assumption that you don't need to contact them because they'll come on their own. But let's move on now to the consequence. Because you point out in your Mint article that as a result, second dose coverage is running about 25% short of what it should be. That's a very sizable percentage.
Yeah, that's a very sizable percentage. And that 25% number is our estimate from whatever data is available publicly. I think there's a bigger issue. the 25%, let's say it's about 4 or 5 weeks delayed, there's a bigger issue, which is that as you move forward, it'll become more and more difficult to vaccinate the population that's left out, right? So when you take second dosage, it's running 25% short, as you mentioned. Give it another 4 weeks, 5 weeks, 6 weeks, and that will be covered. But as you move forward for complete population coverage on the vaccination, when you don't have this kind of understanding of where people are, how do you reach them, it'll cause even greater issues.
And you make that point very powerfully in your Mint article. You write, and I'm quoting you, the last 25% of the country will be the hardest, and most of them will be the most vulnerable and disadvantaged. Not only are these the hardest to reach, but they're also the most vulnerable people who you need to reach, because God forbid they should fall ill, they will be least able to protect themselves and get good health care. And yet those are the ones that the system looks as if it is least able to reach.
Yeah, that's absolutely true. And is it surprising? Should it surprise us? I don't think it should surprise us. They are the most vulnerable. We live in a country where the most vulnerable are distanced from pretty much everything. So it shouldn't surprise us that, the most vulnerable will be left behind.
But what it means, Mr. Behar, is that people who have been traditionally and historically left behind, I will go one step further and say actually ignored by the Indian system, are once again being ignored. Surely, because we know that these are vulnerable people who the system often manages to overlook, special efforts should have been made to reach out. Once again, that special effort to reach out to these people has not been made, because that follows from everything you're saying.
So, Karan, in the way you pose that question, right, it lumps everything together as though the government is one thing and it's doing it in some way, the way you're talking about it. And I have been repeatedly trying to point out to you that there is wide variation. To me, it'll be completely unjust. Karan, 1 minute. It'll be completely unjust to lump some state government officials who are doing everything possible to reach out the most vulnerable.
Let's not talk about governments. Let's talk about the system. Yeah. I don't think the Indian people who are getting left out really care whether the blame pins on the central government or the state government or individual A or individual B. That is a concern you and I have, because you want to be desperately objective and you don't want to be critical of people. And I understand and respect that. But look at it from the point of view of the Indian people. They are getting left out. They've been historically left out. The government or the system should have known it would happen again, and they did nothing to counter that. As far as the people are concerned, the system, let's not say government, the system is letting them down all over again.
So, Karan, 2 things. 1, did nothing to counter is not correct. That is not correct.
So didn't do enough.
Don't make such
didn't do enough and didn't do it successfully. Yeah. So, otherwise, the problem wouldn't exist. You've written about it.
So, did not do enough is absolutely accurate. But did nothing about it is not accurate.
Let's not be technical. Let's not be technical.
Second.
Let me tell you something. If you didn't do enough, as far as the Indian people are concerned, you didn't do anything. It only is sufficient if they get vaccinated. If they're getting left out, then it's not enough. And in fact, as far as they're concerned, it's nothing.
Second, Karan, is that should it surprise us? Should it surprise us that in the case of vaccination, this is happening? This is true of the Indian, quote unquote, the system for everything. Isn't it true about education? Isn't it true about healthcare? Yeah, so why should it surprise us?
No, it's not a question of should it or should it not surprise us, because the way you phrase it makes it seem it's inevitable that India will never be able to do anything successfully. And maybe you're right. But the point I'm making is this. If it shouldn't surprise us, it's something the government or the system was aware of, and they haven't done anywhere near enough to counter it. And this is a moment when countering it is critical, because look at the consequence you mention in your article in the Mint. You say, and I'm quoting you, "We may soon be awash with vaccine supplies but we will not know who these have to be delivered to, when and where, and how to make it happen. That is really going to be a bizarre outcome because we haven't anticipated the problems, because we haven't catered for them. And I won't repeat the problems again. We could end up in a situation where we have awash with vaccines, literally awash with vaccines, and don't know how to get it to people. And yet those people desperately need it.
Absolutely true. Absolutely true. And that is something that faces us. If we don't do a much better job of planning on the ground across the country, and if some states are able to do it, there's no reason why other states should not be doing it. Absolutely correct.
And you know, the other consequence, and again, I'm quoting your article from the Mint, if we don't rapidly improve our on-the-ground execution, it may well be a year before India is fully vaccinated. That is dreadful.
Yes, indeed. Yes, indeed. It's dreadful. And it's even more dreadful because of what we were discussing. And we seem to continue to disagree on the phraseology of that, but perhaps not the gist, that if it takes another year to get vaccinated, who are the people who will get left behind? They are the most vulnerable. Absolutely.
Which means that despite the multiple advertisements, despite the ministers who are constantly giving credit to what they call the vision of the Prime Minister, despite the fact his face is on every vaccination certificate, not enough critical thinking was done when the system was being created. That is something we have to accept. We could have and should have known people won't motivate themselves. We'd have to reach out to them. We should have known we need their addresses, particularly in areas like rural and tribal areas where phones don't work or where numbers are inaccurate. We should have known that we need teams to actually go out and do so, even if we manage to move camps into villages, but we still need teams to go mohalla to mohalla, house to house. Those are things Indian bureaucrats for 70 years have been anticipating. And if they haven't in this instance, then the system has let down people.
So, Karan, I don't want to end on that note. And the reason is because, we continue to disagree on this particular matter. On the ground, there is no one system. And by that statement of yours, it sort of lumps all the states together, all the wonderful work that's happening in districts together with stuff which is completely mismanaged. And that I don't think is fair, right? It's just an unfair way of looking at things.
You're very welcome, and you have a right and a prerogative to the last word. All I'll point out is that the impression that I was conveying, and often the words and exact quotations that I was citing were from your own article. I was talking about the image and impression your Mint article created, but you have every right to slightly back away from it. That is, after all, your prerogative, and one, as an Indian citizen, no one should ever deny you. I thank you, however, for opening the eyes of the audience. Let's not carry on with that quarrel. I think it's irrelevant now. People have understood what you're saying. You don't want to point fingers at the government, and that's your prerogative. But let's move on to the more important thing. I thank you for having opened the eyes of the Indian people to problems that up till now no one had written about. How critical it is to have addresses, how important it is to have teams so that they can go house to motivate, and how wrong it was to assume, particularly in a country like India, that people will come forward of their own volition. Britain and America, France and Europe didn't make that assumption. It was bizarre that we in India should have made it. And those are issues that I believe you have been the first to raise, and I thank you for doing so. Take care. Stay safe.
Thank you, Karan. Thank you so much. Thank you.